And now to COVID-19 vaccines and pregnancy. Just in the last 2 weeks, the CDC recommending pregnant and breastfeeding moms get vaccinated. Several studies determining the vaccines are not only safe, but can even provide antibodies to newborns. Yet many women still opting not to. The task of convincing them made harder by online rumors. Tonight, the push to vaccinate set back by misinformation.
The medical community, we're scared. It was scary last year. It's getting scarier by the minute.
Dr. Dina Hubbard, a pediatrician for Children's Mercy Hospital in Kansas City, says there's two big factors. One being the rise in Delta variant cases. The second, distrust in vaccines amongst pregnant women.
I've discharged babies from the NICU, and their mom's not the one taking them home because she died of COVID.
Now Dr. Hubbard, who also serves as the chair of the Public Policy Committee for the Kansas chapter of the American Academy of Pediatrics, is working to debunk false information women may have heard about the COVID vaccines.
I know there's some misinformation out there about infertility and stillbirth and different things like that for pregnancy, and that is not the case. They've studied, I believe, over 130,000 women that have had the vaccine, and none of those things are increased with the vaccine.
And that's actually one of the things I really wanted to dive into as well. This notion that the vaccine is going to make women infertile. And it's something that actually hits very, very close to home for me because my husband and I, we have been struggling with infertility for years now. And it really, when it came out with the vaccine, when it came to deciding whether or not I was going to get it, I weighed the pros and cons. I decided to get the vaccine because I knew it would ultimately be best for me. But I guess I'm just curious, how do we convince women otherwise that this vaccine is not going to lessen their chances of having children someday?
I know that is a real concern. And I would say that as a mom, I had my 18-year-old daughter get the vaccine. And it's risk versus benefit. And so I would tell women that if you want to be alive to potentially have a baby at any time, really the thing you need to do is to get the vaccine.
And I tell you what, Molly, the biggest thing I took away from that as well is, we trust our healthcare providers so much with all this other advice, when it comes to anything. And my husband working in healthcare, and him saying, despite these issues that he and I have with me being, possibly infertile and having these fertility issues, it's one more thing, but just hearing it from him that, yes, I want you to get the vaccine, and then hearing it from her as well. I mean, the more people you can talk to that you trust their advice, that will really, really alleviate some of these fears I think a lot of people deal with.
Yeah, but also very brave of you to share your story and what you all are going through as well, but it also, brings out the message that you're going through it too, and a lot of other people might be as well. So you're somebody to relate to and somebody that also has an important message to share.
Exactly, and I still got the vaccine. I'm still very confident in that, and I would not take that back for one day.